My name is Cherish Hart, and I'm the Regional Vice President for the American Heart Association. And I'm excited to be able to share a little bit with you as part of the Rural Health Connections program about the American Heart Association's work with blood pressure and how you are now a part of that in your community. So today we're going to walk through the why behind this and then the how, and then make sure that you understand your role and how you can help community members to achieve optimal health. I'm going to start with a little bit of a story. You guys are librarians mostly, and so I thought stories would resonate with you. So this is a nonfiction story. It's about a librarian who was doing her job in the Tampa area and decided to check her blood pressure using one of the machines that were set up through the Libraries with Heart program in her library. Now, what she discovered changed everything. Her reading was dangerously high, and she had no symptoms whatsoever. But that quick check led her to eventual hospitalization and ultimately saved her life because she found out about this high blood pressure that was undiagnosed and unknown about. And she later described herself as one of the first beneficiaries of the Library with Heart program. And today, she's not just healthy, she's one of the strongest advocates for bringing the resources of blood pressure screening to more communities. Now, her story reminds us that sometimes the most powerful impact happens quietly. It's in everyday places like the library. And I'm sure that's something you're familiar with as you see this in a lot of your work as well. So, this is a reminder that this is not just about machines or numbers. Blood pressure is about it's about lives. It's about creating spaces where health and learning can come together to make a difference. Now, let's talk about blood pressure, high blood pressure, what it is, why it's important. About half of the United States adults suffer from hypertension, and estimates are that 1 in 4 don't know that they have high blood pressure. And we are additionally particularly concerned because some populations are disproportionately impacted by high blood pressure. Black and Hispanic people are twice as likely to develop hypertension. And that disparity can be related to social determinants of health, many other factors. And when you think about rural communities where you are, there's also a greater risk and prevalence than in urban communities. In fact, 17 to 19% higher odds of hypertension than those in urban settings. Now, the greater risk for hypertension can result in more heart attacks, heart disease, including strokes, which contribute to disproportionate negative outcomes in our communities. And so that's why we're here, is to combat this reality. Well, let's go back to like blood pressure. What is it? Now, blood pressure is something we all have. We need a blood pressure, right? Because blood pressure is, blood is what our blood tissues and organs need to survive. It brings oxygen throughout our tissue. And when your heart beats, it creates pressure that pushes blood through a network of vessels in our body. That pressure, called blood pressure, is a result of two different forces. The first is called systolic blood pressure. So if you've ever had your blood pressure taken, that's generally the larger number, or we say the top number. And that top number, or the systolic blood pressure, indicates what the pressure is being exerted when your heart beats and that blood is forced through the arteries. The bottom number, also known as the diastolic blood pressure, indicates the pressure in your arteries when your heart relaxes. So the higher number is when it beats and is pushing the blood through, and the lower number is on that relaxed part of when the heart is on the downbeat. So, if your blood pressure is high, then that means the pressure when your heart is pushing the blood through your vessels is higher than it should be. Healthy blood pressure is below 120 and below 80. So that top number, the systolic number, should be below 120. And that bottom number, the diastolic number, should be below 80. So high blood pressure is not just about having high blood pressure. It's really what we call almost a domino effect. It leads to many other things that can be really highly consequential to your ultimate health. It's called the silent killer because it doesn't have any symptoms and it only can be found through diagnosis and screening. What it can lead to are things like stroke, heart failure, heart attack, sexual dysfunction, kidney disease, vision loss, all things that truly you can see have an impact in healthy life outcomes. The good news is that high blood pressure is not only preventable, it's also treatable. By adhering to a healthy lifestyle, by regularly checking your blood pressure, and when prescribed by a doctor, taking medication that's required, those things can help keep blood pressure at those right levels below 120 and below 80, and both prevent high blood pressure from happening and then treating it if it is diagnosed. So I mentioned before that high blood pressure is known as the silent killer. And that is really, I'll say again, because it has no symptoms and it cannot be detected without being measured. So when it's left unmanaged and undiagnosed, it's dangerous, a very dangerous condition that can lead to those consequences we saw in the earlier slide. And 1 in 4 adults walking around our towns don't even know that their blood pressure is too high. And that's why within your community, having these blood pressure stations available is so important. It gives people an opportunity to identify that there's something happening within their body and then getting them connected to a healthcare provider that can help them get those numbers under control. So what do these stations look like? Hopefully it's set up in your library already. If not, you can get it set up through the information here. There's two different approaches. The first that we recommend for every library to have is a self-check station that's available to people coming into your library to use. This is really a place where anyone, anytime you're open, could come and access that their blood pressure at any time that it's available. And there's also information that goes along with that station. The second, a more optional approach, if your library has the space and the opportunity to do this, is to offer checkout kits that have the same kind of blood pressure education materials and that people can take home, monitor their blood pressure at home, and then return that device. Just like you were to have a library of things or your books, obviously, checking them out and returning them. So we'll go into both of these options here a little bit more next. So when you hear blood pressure station, you might think some giant, enormous station in your library and that you have no space. There's a lot of flexibility in what a station could look like. The reason that we encourage every library to have the station available is that if people don't always want to check out blood pressure devices, but by having it in the library, that keeps it equitable, that anytime anybody comes in, they're able to access this community resource. So there is a larger station that some of you may have set up in your library that looks more like the picture on the right with the white and blue cuff. That is very accessible to individuals that come into your library to use, very turnkey. But if you don't have space for that, another option that many libraries are using across the country is to use just the regular kits. So the home monitoring device, and you can either keep it under the circulation desk and people can ask for it from the desk and use it right there. Or you can also have it displayed at a location in your library, whether that's at a table on the side, sort of like the picture here on the left with a gentleman, or if it's right there at the desk, if you want to keep a closer eye on it. So with that station, there is a flyer that goes with it that you can display that shows the individual who's come in how to accurately take their blood pressure. And we'll walk through that a little bit later in the presentation for you to see what is on that flyer. And then on it, there's also a QR code that they're able to scan so that they could view a video if they want further instructions. You also have blood pressure logs that you can have available for the patron who's come in, and referral sheets to help connect them with a clinic so that they can take those things home with them and get more information on how to improve their blood pressure once they know there may be an issue. Okay, so the second option is some of you may have the blood pressure kits for checkout. And with those, you would have those in some sort of a box. And in it comes the blood pressure cuff and the blood pressure measurement device, the instruction booklet, the blood pressure logs and referral sheets, and bookmarks. And so these you could either use as your station, so keeping one at the library at all times, and then others could be checked out to provide for individuals. And you would set that up in your checkout system, just as you do with any other resource that you provide for checkout in your library. So, your role as staff in the library is to truly be a conduit of information and a resource providing the equipment to the community members. You absolutely are not there to make any diagnosis or offer medical advice. We are not trained or licensed medical professionals. Just like with if you had a hammer in your library of things, you are not showing them how to use the hammer. You are providing the hammer for them to use. So in this case, you're providing the resource of the blood pressure equipment and pointing them to the resources that we are providing so that they can learn how to use that effectively and what to do to act on their health outcomes. So, if they do ask you medical questions, remind them that you're not a medical professional and that they can and should talk to their doctor or healthcare provider. And if they don't have one, then there are some referral options that we're providing to each site of some local healthcare centers that could help. All right, so you are not responsible in showing them what to do or how to do it, but as we still want you to know how to take blood pressure effectively so that you yourself can use the equipment, just like our woman in the story earlier, and so that if there is something that you could help explain the instructions or show the instructions to someone. So these things are also available on the sign that will be with your station kit and in the monitoring kit box as well. But the important things when you're taking your blood pressure to think about is a few things to do to prepare yourselves ahead of time. The first is you don't want to be exercising, smoking. Well, don't do that at all. But if you were smoking, definitely not in the 30 minutes before taking your blood pressure, drinking a bunch of coffee or alcohol or eating a big meal, all of those type of things, your body kind of has this reaction to intense activities. And for the 30 minutes afterward, that will impact your blood pressure. If you have to use the bathroom, you should do that before taking your blood pressure. And then give yourself a few minutes. Take 5 minutes to rest and sit, be still before taking your blood pressure. Running in right away and taking it after coming up the stairs, your blood pressure numbers are going to be off. So once you've done those things and make sure you're prepped properly, then when you put on the cuff, you'll want to sit still. You'll use a chair. So where you set up your station is important. You'll want to have a chair available for the individuals to sit. A chair that has a back that can support their back properly so that they can sit up straight with a supported back and be able to put their feet flat on the floor. That's the best way to get a best type of reading. So you may even want a chair that's adjustable for those of different heights to make sure that they can have their feet on the floor flat and their back supported, and that they can then relax their arm on the flat surface at heart level. So that's the next step. They're sitting in the chair, back supported, feet on the floor, and then resting your arm on flat surface such as a table. They would simply then put the cuff directly above the bend in their elbow, aligning the cuff marks with their arm. And it really needs to be placed on bare skin or on a very thin type of shirt to get the best accurate reading. Now, if they're measuring at home, it's important for them to continue to measure at the same time every day. That helps to get a more accurate reading. Okay, so but we were just talking about it happening inside your library. Once they place the cuff on the arm, they'll hit start, and the blood pressure cuff will automatically inflate, squeeze their arm a bit, and then it'll deflate. Once that happens, it will display their diastolic and systolic numbers for them, and they can record it on their blood pressure tracking log. So, and make sure you have copies of those logs available at your station and in the kits for individuals to take and keep those, along with those clinic referral sheets, so that if they do need to go find a healthcare provider, they have that information to keep with them handy for the next steps. Okay, next, I'm gonna stop talking for a bit. I'm gonna share a video with you. This is a video that the individuals who visit your station will be able to access through the QR code on the sign. And they can also access it in the booklet that comes with the stations as well. But I want you to be able to see that same video so you know what they know. So let's take a look.
Spring, the unofficial year for tool people. New jobs, new projects. Your
Okay, let's have a real talk about blood pressure. Do you monitor yours regularly? It's something everyone with high blood pressure should do, but it's something most people don't know how to do correctly. Checking your blood pressure regularly will help let you know if you have it under control. It will also help you start to understand which factors are putting you at high risk for stroke and heart attack. Before I get to that though, I just want to stress one thing. If you have high blood pressure, you should talk to your doctor to figure out how frequently you should be checking it at home. For most people, taking your blood pressure twice in the morning and twice in the evening, even just for a week, will help you and your doctor get a better understanding of your blood pressure. For morning readings, it's best to take those before you take your blood pressure medication. It's also very important to avoid exercise, caffeine, or tobacco at least 30 minutes prior to testing, since those can affect your levels. Now, let's move on to talk about the proper way to measure your blood pressure at home. Nearly half adults in the U.S. have high blood pressure and are at high risk for stroke and heart attack. So self-measuring is one of the easiest ways to be proactive about our health. Here I have my blood pressure monitoring device. It's easy to use and it helps me get an accurate reading. Be sure to get an automated device with an upper arm cuff. That's the type doctors recommend. The first thing you want to do is find a quiet place to sit where your back is in an upright, stable position. A dining room chair is great. You want to make sure the chair isn't too soft so your body is fully supported. Sit with your feet flat on the floor and don't cross your legs or ankles. If you need to use the bathroom, make sure you go before you do your reading. Next, rest your arm on a flat surface with your palm facing up. Place the blood pressure cuff on your bare upper arm just above your elbow. Your arm should be relaxed and resting so the cuff is at the same height as your heart. Now rest quietly for 5 minutes before taking the first measurement. Avoid talking while taking your blood pressure measurement. Once your first measurement is completed, write down the blood pressure numbers and pulse that are displayed on the device. Wait 1 minute and then repeat this process again. As you just saw, it's important to check your 2 measurements at around the same time each morning and evening. At your next doctor's visit, be sure to share your blood pressure numbers so you can discuss the numbers and so your care plan can be changed if necessary. That's it. Not bad, right? Measuring your blood pressure at home is easy to do and a great way to stay on top of your health. If you have more questions about managing or measuring your blood pressure overall, visit the website. Okay, let's have a real talk about blood pressure.
Like, well, great. I think she did a much better job explaining how to take your blood pressure than I did. So I appreciate the assist there. So that's a great resource. Have the individual take a look at that video. I think it'll be quite helpful to them, as well as the information in the booklet that's going to be provided with the kits as well. So here's a quick look at the blood pressure logs that are provided as well. We have those in both English and Spanish for all of your patrons to use. If you really need other languages, you can reach out to us and we can help with that as well. In addition, there's that referral sheet that I mentioned. On that sheet, it has a quick reminder about, how they can participate, really reiterating the importance of connecting with their healthcare provider and also outlining when they should do so, depending on what their blood pressure reading was. And then in your community, we've identified at least one location that is available for them to contact if they don't have their own healthcare provider already. Okay, so what the checklist is for you, if your station is not set up already, or maybe once you've seen the video here, you may need to adjust your station to have the optimal outcomes for people to check their blood pressure. Get that station set up. You add your checkout devices to circulation if you're using those. Promote the availability of it. Maybe you want to share it out on social media, have some signage up in your library. Really encourage patrons to use those available resources. Now, about a little note about cleaning the device and cuff. They're pretty simple and easy to use. They are not something that really carries a lot of heavy germs or anything like that. So you would just want to clean them like protocols that you have for other things in your library. You can use mild soap or water or disinfectant wipes, alcohol wipes on the cuff and on the machine to keep them disinfected. You just wouldn't want to use strong chemical solutions or bleach in the cleaning. I believe that you're also provided not only a stockpile of instruction booklets, the tracking logs, and the clinic referral sheets and bookmarks, but also the digital versions of those so that you may need to restock some of those things as you go along as people are using the tracking logs or taking those clinical referral sheets home with them. So those are accessible to you. You're also, maybe you develop new relationships in your community that you want to add to those sheets. You certainly can do that as well. Well, I appreciate your time and appreciate you being part of this initiative. It really is helping people to identify that silent killer in communities by understanding their blood pressure and knowing what to do about it. So thank you for being a part of that. If you do have questions that come up, ideas for the future, or even some great stories, right? So maybe you hear back from someone in the community who identified their need and connected with their healthcare provider. we'd love to hear about that. Or if there's other resources that you have, maybe in other languages that we can help with, do reach out to us. My email is here on the screen, cherish.heart@heart.org. Or if you're connected with your local American Heart Association representative, they can also help you as well. So thank you for all that you do, and take care.